Welcome back to the Now Morning Show. The conversation on men's health awareness continues this morning on the Now Morning Show as we shine a spotlight on prostate cancer.
Inside your spotlight this morning, we continue the conversation about Men's Health Month all June long. This morning, I welcome oncologist Dr. Satyendra Persaud, who joins us via Zoom to chat a bit about prostate cancer. We're talking screening, symptoms, and so much more. Good morning to you, Dr. Persaud.
Hi, good morning. How are you?
So far, so good. How are you doing this morning?
I'm all right. I'm actually a urologist, not an oncologist.
Oh, nice. Well, that's a good correction. Thank you very much for that. All right, let's get into the conversation about prostate cancer. First of all, what is prostate cancer? How do we define it? And what are some of the things that we should be looking for in terms of symptoms?
So the prostate gland is a small walnut-sized gland at the bottom of the bladder. So you have the bladder, you have the prostate, and the urine passage passes through the prostate to get to the outside, to get through the penis and to the outside. It's a gland only found in men. It serves a sexual function. The secretions from the prostate help to nourish sperm, and it liquefies the semen as well. So it does serve a purpose in reproduction. Unfortunately, it can get cancer, and prostate cancer is very common. It's the most common cancer, second most common cancer overall in Trinidad and Tobago, and the most common cancer among men in Trinidad and Tobago, especially Black men. It's important to note that while there are symptoms from prostate cancer, like difficulty passing urine, blood in the sperm, weight loss, anemia, and even kidney failure, bone pain in advanced cases. In early stages of prostate cancer, there might be no symptoms at all. And that's why it's important to get screened for prostate cancer, because you can have a long time where you have this cancer and you don't know. It remains asymptomatic, and you carry it there. And when you actually do find out, it's probably going to be too late in many cases.
Doc, tell me, what are some of the things that cause prostate cancer? Is it just something that happens?
A lot of it is genetic. It tends to run in families to some degree. Hereditary prostate cancer is a different thing. Some of it is genetic. You see in Trinidad, consistently the data have shown that it's much more common among Black men. So if you have a group of men, Black men are, and we have multiple studies showing the same thing, are affected 3 times as much as Indians. And not only are they affected more commonly, they tend to have more aggressive disease and higher risk disease as well.
Was there a cause that determined why that is?
We're looking into the genetics of it now, actually. There are ongoing genetic studies. I mean, the studies required to do this at a high level. So there would be specific genes, and we're looking into this as well for our local population.
All right, so let's talk screening a bit, Doc. What is the process of screening like? Because a lot of men still have this stigma and they don't want to go and get screened, or they don't want to go and get tested because they feel it might be too invasive, as the case may be. Tell us what the screening process is like in 2025.
So there are 2 tests that we usually use for screening, right? We use the blood test called the PSA, and PSA stands for prostate-specific antigen. It's a substance produced by the prostate, and it's raised in prostate cancer. It's specific to the prostate, but not prostate cancer specific. So a lot of other things can cause it to be raised. There's also the digital rectal examination. Now, I want to be clear that you don't have to have a digital rectal examination to get screened for prostate cancer. More and more, we're realizing that the digital rectal examination is of limited utility, but we still do it because there's the odd case every few hundred cases where the prostate specific antigen is normal, and the only way you pick up that cancer is with the rectal exam. But I don't want men to be put off. A lot of the biggest barrier to screening, a lot of times, is men thinking they have to come for this digital rectal examination. You don't have to. We would at least like to see you get a prostate-specific antigen test, which is just a simple blood test. It takes 2 minutes, than not get screened at all because you think you have to come for this rectal exam. Do we prefer to do a rectal exam? Sure. It gives us information. But do you have to do it to get screened? No. At least get that blood test. It could save your life.
Now, you said digital rectal exam. Can you give us some more details as to what that entails? That's the same one with the finger, or we have a digital device?
It's the same one. It's the same one with it's the same one with the finger. Basically, it's an index finger test. You lie in lateral position and you actually feel the prostate through the rectum. But just to reiterate that you don't have to. It's not mandatory to get that if you come for screening. We would at least prefer to just at least have you do that blood test. We prefer to do the rectal exam, but it's not mandatory at all.
So is it that if we do the blood test and we see the levels raised, then we need to do the digital screen?
No, the digital rectal exam gives us more information. But
Okay.
if your PSA is elevated, there's a whole different road to go down. We have the technology in Trinidad now to do that. There are different options. You could simply repeat the PSA. If the person has symptoms of a urinary tract infection, you might need to give them some antibiotics and then repeat the PSA. You can do an MRI scan, which gives a lot more information on the state of the prostate. Or you can do a biopsy. And that's something to have a discussion with your urologist. So once your PSA is elevated, remember we're screening you. We're going to just check to see if your PSA is elevated. If it's elevated, then you go down a different road. Then you have to see a urologist and determine what's the next step.
All right. Well, speaking
Some
of
patients
next
with an
steps,
elevated PSA will come back negative as well.
Okay. So let's talk next steps. When we are ready, all right, so if you've got the diagnosis and you say, all right, so you have tested positive for prostate cancer, what would be the treatment process like? Or does it vary depending on your stage of cancer?
It does. It depends on how high your PSA is, basically, and what your biopsy shows. If you've done a biopsy and it comes back positive for cancer, then you're going to have to check the stage of that cancer. That involves doing scans like CT scans, MRI scans, PET scans, and depends on if your cancer is localized to the prostate. We have treatment will be different. So if it's localized to the prostate, you can do radiotherapy to the prostate. You can do brachytherapy, which is a form of radiotherapy. You can remove the prostate gland altogether. If it's spread outside the prostate, well, then that's a different mode of management, the backbone of which is reducing the testosterone in the body, either by injections or by surgery. But the point is, we can screen very easily for prostate cancer. And if we do find prostate cancer, we have treatment locally.
Doc, at what
Both
age
surgical and non-surgical.
at what age should we start screening? Sorry, for prostate cancer.
Depends on race and family history. If you have a strong family history of prostate cancer, I would say start screening at 40. For average risk men, most people would recommend probably starting screening at 50, at age 50. But for Black men or for men with a strong family history of prostate cancer, I would say between 40 and 45. And that's as simple as doing a blood test every year.
Okay, and annually is okay.
Annually is okay.
All right, nice. I think we got most of the information out. Anything else that you think you want to make sure that we cover when we talk about prostate cancer and getting screened?
I think to not to belabor the point, but prostate cancer, most men seem to think that, oh, I don't have any symptoms. I can't have prostate cancer. But prostate cancer can have a long phase where there are no symptoms, and that is the point. That is the time where you need to catch it. A simple blood test can save your life, so don't let it delay the stigma of a rectal exam. Delay you seeking screening because you don't have to do the rectal exam. At least do that blood test. Once you do the blood test, if it's elevated, we have a number of different pathways you can go down, and good treatment is available locally, both in public and private sectors.
Now, Doc, when we talk prostate, some of the things that can happen is an inflamed prostate, yeah? What is
Yes.
that related to cancer, or what causes that, and is it treatable?
No, that is something different, and that's one of the things. When you see an elevated PSA, you need to make sure that it's not from an inflamed prostate or prostatitis. Prostatitis, a number of different types of prostatitis, acute and chronic prostatitis, all of which are treatable, mostly with antibiotics. So
Okay,
if you think the person has prostatitis, then you need to know you need to give them a course of antibiotics and then give them at least 4 to 6 weeks to repeat that PSA.
Okay. And in terms of prevention of prostate cancer, is there anything that we can do to ensure that your body is as healthy as it can be when it comes to that in particular?
I think the best advice you can get is to eat a healthy diet. There is some evidence of cruciferous vegetables like cabbage and these things helping. There's one study men like to quote, average men like to quote that the more you ejaculate, that reduces your risk of prostate cancer. They particularly like to show it to their wives. That's just one study. But hey, no harm.
Wait, hold on.
You know,
You say no harm. Does that mean it's true?
well,
It-
there is a study saying so, right? And there are a bunch of different theories of whether it clears out toxins, and not going to speculate, but no harm.
No harm. Okay. Thank you very much for that, Doc. Anything else you want to give us before we leave this morning?
The best advice is to eat a healthy diet, and then and get screened early.
All right. So early screening, healthy diet, and especially if you have family history or if you are of African descent, then you definitely need to be checking from age
Get screened
40.
early.
Yeah, checking as early as
Yes.
age 40, yeah?
Yes.
All right. Well, Dr. Persaud, thank you very much for your time. I know that you're busy doing work out in India when it comes to prostate cancer as well. So please be safe, and we look forward to chatting again soon.
All right. Take care.
All right. You too. Ladies and gentlemen, that's Dr. Satyendra Persaud, urologist, chatting with us this morning about prostate cancer, diagnosis, treatment, causes, symptoms, preventionary methods, and all. Ladies, any input? No?
Something that is particularly important, and gentlemen, please go and get tested. One of the things that I'll always say that I do enjoy about this particular conversation is the fact that they have moved away from that physical rectal exam, and you do have the option of having something far more technologically advanced, which will probably, I guess, be a bit more.
No, he said the other one gives more information.
I was just
Digital
about to
rectal
ask
exam
how
gives
you
more
feel.
information.
Yeah, you're the man.
But
You're the
you're an
man.
actual man.
No, I
and
mean,
you're
it's not the
close
first
to
time we've had this
that
conversation about
Right.
prostate cancer. So I think, in the 5 years of doing the show, I've heard about it several times. I did the PSA one already, even though I don't have a family history of it. But like they say, I'm black, so.
And I think what's troubling with things like cancer and a lot of generally a lot of diseases in men in particular is that asymptomatic thing.
Yeah.
You really don't have any
don't know
sort of
until you know.
symptoms until it's too late. Unfortunately, I've lost a close family member to prostate cancer, and it was similar the case. Fine. Up till he wasn't.
Yeah.
And so that screening is really, really important. It really is pleasant or more pleasant to think of a less invasive option.
Yeah.
But the reality is that it gives you more information. So consider that perhaps if you're checking later on as a black man with a history, it might just want to go that way. It's a couple of seconds, you'll be fine.
Yeah, and the thing about it is because of this less invasive method, I hope that a lot more men are able to say, well, yes, I will be
Screen
comfortable
earlier.
to go and get screened because I know it's not as invasive. Because it was a taboo thing. It's like, I know you can't come around with that, doctor. You ain't going through that. You don't have to worry about going through that this
Meanwhile,
time.
the doctor doesn't want to
The
do
doctor
it.
doesn't want to go through that. The doctor doing it for your benefit.
Necessity, no pleasure derived. Weirdos.
So, all right, guys. Well, we continue the conversations here on the Now Morning Show. We're taking a quick break and we come back with more. Stay tuned.